It's Tuesday, and joining us now is In Focus Health correspondent Linord Moudou with some important global health stories. Linord, what do you have today?
Well, we're looking at non-communicable diseases today. But first, the H1N1 swine flu virus continues to make its way around the world, with at least 8,800 cases confirmed in 40 countries. The virus was at the top of the agenda this week as health officials from almost 200 countries met for the World Health Assembly in Geneva, Switzerland. Voice of America's Melinda Smith has more.
Mexico has been the epicenter of the outbreak. During the World Health Assembly, Mexico's Minister of Health, Dr. Jose Angel Cordova, was applauded when he spoke of his country's duty to warn others of what lies ahead.
Mexico alerted the rest of the world early to the risk of this epidemic, and in doing that, we believe we have helped to give other countries the possibility to prepare.
The World Health Organization reports that 95% of the confirmed cases of the H1N1 virus are still in Mexico, the United States, and Canada. However, Japan, Spain, and the United Kingdom are now reporting more than 100 cases each. Dr. Margaret Chan, Director General of the World Health Organization, says for some time governments have known that preparedness was needed.
We have lived for 5 long years under the threat of pandemic caused by the lethal H5N1 avian influenza virus. This has left our world better prepared, but also very scared.
The influenza season is now underway in the southern hemisphere. Dr. Chan is predicting epidemics in several countries where the virus has been reported in that part of the world. Because the new H1N1 strain spreads rapidly from person to person, researchers have been working furiously to produce a vaccine in case the virus regains strength and affects greater numbers of people. U.S. Health and Human Services Secretary Kathleen Sebelius says production of a new vaccine is not intended to disrupt production of a seasonal vaccine.
U.S. government agencies are working together in an unprecedented way to take the steps necessary to develop a vaccine against the H1N1 virus should there be a need for it, and doing it in a way that ensures the production of seasonal flu vaccine continues.
The World Health Organization estimates that as many as 2 billion doses of the swine flu vaccine might be produced. The vaccine may be ready in 4 to 6 months. Melinda Smith, VOA News.
And coinciding with the meeting of the World Health Assembly, heightened concern about non-communicable diseases. The International Diabetes Federation, the International Union Against Cancer, and the World Heart Federation are calling on the international community to address what the groups call the epidemic of non-communicable diseases. Such diseases are responsible for 35 million deaths a year, and the health groups want an increase in funding and essential medicines in line with Health Millennium Development Goals. Joining us from Geneva, Switzerland to discuss this topic is Ann Keeling. She's the Executive Director and CEO of the International Diabetes Federation. Ms. Keeling, welcome to the program.
Thank you, Linord.
First and foremost, tell us what are some of these diseases and why it was important to bring them at the forefront.
Well, the 4 major non-communicable diseases that are affecting the world right now are the cancers, diabetes, chronic respiratory disease, and cardiovascular, which is heart disease. And although it's not often understood, those 4 diseases together are actually the leading cause of death globally. And they are now the leading cause of death in low and middle-income countries. So non-communicable diseases like diabetes used to be considered diseases of the rich world and the elderly, but now the burden has shifted to low and middle-income countries, and 80% of the cases are in low and middle-income countries.
And why is that? Why is there this shift?
It's a whole range of things. The most important factor is changing lifestyle. It's the way in which people eat. It's obesity. It's lack of exercise. There are other reasons as well. It's partly also that these diseases are being diagnosed when previously, for example, children might have died in Africa with diabetes. Now health systems have got to the point where they can actually diagnose them, and so we know those children have diabetes. But it's generally to do with changing lifestyles and people living longer.
Now, the issue that you are raising along with other groups is the fact that these diseases are really impacting third world countries because sometimes it can increase poverty. Tell us about that. How is this happening?
It's a real double burden on low-income countries, because low-income countries are still dealing with the infectious diseases, but they've got this huge burden of non-communicable diseases, which is already present. And the way in which these impact on the Millennium Development Goals, for example, is that take diabetes. It's affecting people in younger and younger age groups. So if a family may lose a breadwinner, or somebody may lose a leg, for example, have to have an amputation because of diabetes. And it's hitting people in the prime of their life.
And in 20 seconds, tell us about what you are hoping to accomplish with this conference.
What we want to do is we want to raise awareness because there's just a lot of ignorance about non-communicable diseases, that they are just diseases of the rich and elderly and they don't affect the developing world, and that's not true. We also want to raise the point that treatment is available. We know how to treat non-communicable diseases. The treatment is available. Much of it is now out of patent, and so it costs cents in terms of U.S. money. It costs very, very little, and we can save millions and millions of people.
And Ms. Keeling, that's all the time we have. Thank you so much for joining us, and have a great conference.
Thank you very much. Bye.
Well, bye. This was the issue today.
Very, very informative. We want to thank you very much.
Well, for more information on these stories, go to voanews.com.
And we thank you very much, Linord, for joining us today. Be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa right here on In Focus.